Hello everyone, welcome to PathoMed. Today let us continue with the part 2 of brain autopsy. In this part 2 video, let us study about fixation of the brain. In part 1 video, we have covered the removal of the brain from the cranial cavity. Once brain has been removed, to prevent the tissue decomposition, we fix the brain in a proper fixative. Fixation helps in to prevent decomposition of the tissue and maintain the tissue architecture as close to its living state as possible. So, for further microscopic or anatomical studies, the fixation of the brain, fixation of any tissue is compulsory, it is mandatory. The widest choice of the fixative is 10% formalin. This 10% formalin gives the best nervous tissue stains as possible. So this is the image showing you 10% formalin bottle. In cases of fetal or infant brain fixation, acetic acid is added to the fixative. To 10% formalin, you add extra acetic acid, which increases the specific gravity of the solution. What is the purpose of increasing specific gravity? So that the specimen floats, it floats in the solution, and also the tissue becomes firmer. Since fetal or infant brains are very soft compared to the adult brains, to make it firmer, acetic acid is added additionally. There are two methods for fixing the brain: immersion method and perfusion method. Firstly, let us see the immersion method. Immersion means you have to dip, it is dipping method. For this immersion method, plastic bucket of 8 to 10 liters capacity is used. This is the plastic bucket preferred of 8 to 10 liters approximately. Metal buckets are avoided because metal gets corroded. It gets corroded by the formalin. Hence, plastic buckets are preferred. In this plastic bucket, 8 to 10 liters of formalin is filled. After that, you have to suspend the brain. And how do you suspend the brain? By passing thread underneath basilar artery in front of the pons. Here in this image, you can see this artery. This is the basilar. This is the basilar artery marked as green. It is present in front of the pons. So you pass a thread. Here you pass a thread underneath the basilar artery and you suspend the brain to the bucket by tying the thread to the bucket handle. You suspend in this way. Pass it under the basilar artery, suspend. In cases where you suspect a pontine infarct or pontine lesions, pontine infarcts or lesion, thread can be passed through internal carotid artery or middle cerebral arteries on both sides of the brain. So if at all you're suspecting a pontine lesions, any pathology of the pons, you don't want to disturb the pons, you leave the basilar artery. Now you suspend the brain by passing threads underneath the internal carotid arteries on both sides. This is the internal carotid arteries. Pass the thread underneath internal carotid arteries or middle cerebral arteries on both sides of the brain and you suspend the threads. Dorsal dural flaps can also be used as anchoring points. It can be used, not most widely used, this method, but it can also be used if at all you don't want to use the arteries. Thread is passed through short dural flaps on either sides of the falz and brain is suspended right side up. So this image shows you the flaps of dura mater. So on either side of the falz, anterior posterior falz, the thread is passed through the falz and the right side. The pull, gravity pull is given in this way such that the right side of the brain comes up. Right side up, this brain is suspended in a way of right side showing you up. And rarely, in rare cases, suspend the brain upside down with a pair of threads tied to edge of entire dorsal dural flap on either sides. See, here, these are the dorsal dural flaps. But tying the entire dorsal dural flaps on either sides, you can suspend the brain like upside down. This is the upside. Upside comes down. You tie the threads, you suspend like this. Pull is given in this way. The ends of the threads are tied to the bucket handle so as not to allow specimen to touch the bottom or sides of the bucket. Here, The brain is suspended by passing threads, and these ends of the threads are tied to the bucket handle so that the brain tissue should not touch to any sides or the bottom, so that the fixative comes in contact with the entire surface area of the brain. For proper prompt fixation of the brain is not allowed to touch to any sides of the bucket. And in case, if at all it has to come in contact with the floor of the bucket, a dome shaped, a plastic dome shaped receptacle is placed in the floor of the bucket, and this dome has many holes so that the fixative it perfuses through it. It allows proper perfusion, proper contact with the surface, with the surface of the brain. If at all the brain is coming in contact with the dome-shaped surface also, because of these holes, the fixative it comes in contact with the brain tissue. So plastic brain support, which is dome-shaped receptacle with several holes, it ensures proper fixation of the contact surface of the brain. And this formalin is replaced within the first 24 hours. If at all the fixative becomes heavily bleeded, then prompt replacement for the fixative is done. The approximate time required for satisfactory fixation of the brain is 10 to 14 days. 10 to 14 days is the minimum time. That is approximately 2 weeks is the minimum time taken for proper fixation of the brain. After proper fixation only you can dissect and go further ahead for anatomical or microscopic studies. The second method is the perfusion method. After immersion, the second method we study is perfusion method. This perfusion method is practiced along with immersion method. Perfusion means you inject the fixative through the arteries. You inject the fixative into the circulatory system of the tissue so that it penetrates into the deeper areas, and it allows proper deep penetration of the brain tissue and deeper fixation. So brain is perfused with fixative through arterial stumps. So this is the arterial stumps here, arterial stumps. The fixative is injected through these arterial stumps into the circulatory system. So it shortens the fixation time also. It becomes the brain is fixed earlier, so it shortens the fixation time and adequate fixation of the deeper tissues of the brain. Preliminary fixation by perfusion. That means prior perfusion, later you immerse it. This method makes the tissue firmer, decreases the surface wrinkling and tissue warping. That means tissue distortion is lesser. If at all you are using large volumes of formalin, it improves fixation, but there's one disadvantage that it may distort the structures in weaker areas. Weaker areas means if at all the brain already has this infarcts or hemorrhage or metastatic deposit, those areas are weak areas. In these weak areas, this large volumes of formalin it leaks into that area or accumulates there, and it distorts the tissue. For this reason, large volumes of formalin may be detrimental in already infarcted, hemorrhage or metastatic areas of the brain. For perfusion of these large amounts of fixative, embalmer pump is used. A pump is there, embalmer pump, where you inject into the circulatory system for large volumes of fixative. If at all you want to inject large volumes, embalmer pump is used, or else for normally simple gravity feed method. That means the brain is suspended inside a bucket. Through this arterial stumps you inject. This is the infusion bottle. This infusion bottle is raised. For example, if at all this is the bucket, this bottle is raised approximately 150 to 180 centimeters above the specimen level, and by gravity pull, the fixative is infused into the brain tissue. So these are the two methods of fixation of brain, immersion and perfusion methods. Thank you everyone.